Feeling lost in the darkness of depression? Don't let depression hold you back. You are not alone. Hello everyone, I'm Akansha. Welcome to our channel Talk to Angel series on clinical disorders, episode 4, Depression. Today we have Dr. R.K. Suri, clinical psychologist, with us to talk about depression and how to overcome it. Hello sir, can you please explain what exactly is depression?
Thank you, Akansha. According to DSM, definition of depression is that you or someone should have at least 2 symptoms which are there for last 15 days. The symptoms are constantly feeling sad and depressed and the mood is very low. The other symptom associated with it is the loss of interest and pleasure in things which you were enjoying earlier. So if these symptoms are persistent for more than 2 weeks, then it is considered to be a depression.
Thank you sir, that was quite insightful. Can you also tell what are the different kinds of depression?
See, as far as the kind of depressions are concerned, we classified into following types of depression. First is a major depressive disorder. If this feeling of low, feeling of sadness, mood being very low is, and there is a loss of appetite, etc., insomnia or hyposomnia, and the person is agitated, there is a reduction in the severity, there is a reduction in the thoughts or retarded in the activity, then the most common depression is called as major depressive disorder. The other depressive disorder is persistent depressive disorder, and there are other types of the disorder like seasonal affective disorder, the postpartum depression, psychotic depression, bipolar depression, and sometimes it is also called as situational depression. Now these are the most important type of the depression which are noted in the day-to-day clinical setups.
So sir, there is a friend of mine, she is not talking to me recently. It's been few days that I can't reach out to her, neither of my friends can reach out to her, and later I came to know that she is going through breakup. So what are your suggestions about this, that how can we deal through this situation?
Kansha, this is a very common crisis, what we call as the life event crisis amongst the youngsters. Now, she is not alone. First and foremost thing is that we need to provide a support system in terms of the crisis intervention. If she is not able to reach out to you or you are not able to reach out to her, ensure that you reach out to the family without telling them about the breakup. Be there, provide the support, and ensure that your friend is provided the mental health support and the order first aid support, because many times when one is into a state of depression on account of breakup, the most common feeling is hopelessness, helplessness, and self-harm or suicidal ideation, and on account of it the person is withdrawing himself or herself. So please try to use your network of reaching to her, providing a social support. Ensure that she doesn't make any self-harm activity.
Thank you sir. Thank you for such information. I'll really try to reach out. Sir, can you please tell about some signs and symptoms of depression?
One of the major cardinal symptoms of depression is a mood being low, mood being sad, mood being not able to control. Now in this situation, it is important to understand that you have lost, or you or someone you notice that he or she has changed significantly in terms of the interest, hobbies, and he or she is absolutely into a dark phase. And this is there without any situation, without any context. And it may be because of certain specific incident or events. Then also the person is in the phase of being considered as low. His mood is very, very low. Now, associated with that is the loss of sleep, insomnia, or hyposomnia, excessive sleep, loss of appetite, or there is a significant increase in the food intake, or binge eating, or eating excessively. Now, these, along with that, you are also having a difficulty in making decision, considering in the information processing, or thoughts are not coming and feeling blank. Now, all these symptoms are cardinal feature of person being into a depression state.
So, sir, is depression treatable? Can we treat it?
Yes, depression, first and foremost thing is depression is a treatable disease. There is nothing much to worry about it if it is taken at a very first instant, and it is easy to be considered that anybody who is having a mood disorder called as major depressive disorder or persistent depressive disorder, he or she can take up the help of a professional, mental health professional, particularly psychiatrist or a clinical psychologist, for treatment of his low mood, treatment of his mood swings, or the depression. Every mood swing is not depression. Everybody who's sad is not depressed. So we need to classify, quantify whether the person is really having a depression. Once the person is having a depression, we must identify what are the reasons for his depression, and also treat and provide the modalities of treatment. The treatment modalities may vary from person to person. Now, the most common treatment modality is giving a mood stabilizer.
Thank you for such an amazing session. If any one of you is going through a rough phase in life, please feel free to connect. Looking forward to see you in our next episode.